In this video, we're going to have a look at massage for plantar heel pain or for plantar fasciopathy, plantar fasciitis, whatever you wish to call it. So here's a series of techniques you can do to help reduce pain from the plantar fascia. You can start with your hand, and I like to use the back of my fingers there, making a soft fist, so not a firm fist, but a fist with your fingers are out. And the reason is there your knuckles are more supple, so you can then pass through the tissue without it being too painful an experience for the patient. Okay, so I'm starting from the front of the foot and then slowly working through that longitudinal arch and then up over the heel as well. Okay. If I then use my other hand to hold the foot in a slight stretch position, that can also be beneficial as I move through the foot. Not just going through the medial longitudinal arch, but also coming along the lateral side of the foot as well. So no surprises there, a nice simple massage application with the foot either in a relaxed position or holding the foot into a slightly passively flexed position as well. You can try some direct pressure over the tender points on the foot. This is very variable, and I find lots of patients find this too uncomfortable, but I have a handful of patients that find this kind of focal sustained pressure helpful for reducing their symptoms. It's not a cure, but it's something which can help. And if you're having a consultation with a patient and you've gone through footwear and orthotics and loading and stretching, all the different things that can help a patient, then a bit of massage whilst you're discussing the management and during the consultation can often be greatly appreciated by the patient. Because the plantar fascia has that continuity with the Achilles tendon and gastrocs, if you do have time, I would recommend also massaging through the gastrosoleus complex as well. Massaging this region can be beneficial at generally reducing tension. So if you're working on this area to reduce pain and you've got time, migrate your treatment down through onto the gastrosoleus complex. When working on the plantar fascia, this is also an ideal place to use a massage tool, especially if you don't want to get too close and in contact with your patient's feet. Obviously these feet I've got here are lovely feet, but I'm sure you've all seen feet that you might hesitate about putting your hands onto, which is where a massage tool can come in and be very helpful as well. Be careful not to apply too much pressure. It's very easy to use the metal tool to put too much pressure through the plantar fascia, and I hope I'm not doing that now because the patient's not shouting at me. Once again, migrate your treatment down onto the connected soft tissue, because this can also be helpful. And remember, this is part of the superficial back line that we looked at during some of the earlier lectures. So if you have time, add in that gastrosoleus massage as well. Right, now on the screen here, I'm going to show you some other massage options for the plantar fascia. Using a ball under the sole of the foot is a great way for the patient to self-massage. What a lot of patients find helpful is a bottle of frozen water, because they have the cooling effect and the analgesia associated with that, as well as a nice firm surface to roll on. So a frozen bottle of water has become quite popular recently as a way of reducing pain from the plantar fascia.